And we told you before the break that open enrollment season for the Affordable Care Act, known as Obamacare, began on November 1st. And despite opposition from the Trump administration, a record number of people signed up on day one. Joining us now is physician and former representative for the U.S. Virgin Islands, Donna Christensen. Donna, it's good to have you with us. Thanks for joining us.
Thank you. A pleasure to be with you.
We're happy to have you. So does this cause anyone in Washington, you think, to reconsider, of course, what Trump is trying to push through, a repeal and a replacement of Obamacare?
Well, that would be great, but I doubt it. But I'm glad that the people understand the importance of getting coverage and getting in there while the enrollment period is open. And I'm really heartened by the number of people who've signed up already.
Hey, you're also launching an educational campaign to inform people about changes here in insurance. So what are the biggest changes for anyone who hasn't signed up yet that they need to know about?
Well, first of all, the enrollment period is much shorter than it usually would have been because of the administration's decision to make it shorter. And so it ends on December 15th. And I think that's very important for everyone to know. It's not a 3-month period. It's just 1.5 months. But with every enrollment period, there are changes. And so some of the changes that we want, the Consumers for Quality Care wants everyone to look out for are, for example, whether the plan that you're looking at pays for emergency room visits. There are some plans that will not pay for an emergency room visit after if what you have gone there for turns out not to be an emergency.
Right.
And that's not fair to the consumer. And so we want everyone to make sure that the plan that you choose pays for emergency room visits. We want to make sure everyone to make sure that their doctor and the specialists that they need are in the plan that they choose. That the medication is in the plan that they choose, the medication that they need and at the lowest cost. Different plans may have the same medicine at a different tier at a different cost. We want them to look at whether the plan has a copay or a coinsurance. A copay is a flat fee, while a coinsurance is a percentage, which could be significantly higher cost to the consumer. And in addition, some people use coupons or programs that help them to pay for their medication. We want them to make sure that the plan that they choose counts that payment by the coupon towards the deductible as well. So those are some of the areas, and on our website, consumersforqualitycare.org, we list them, and we would encourage people to check our website as they look at the plans.
That's great. Can you talk a little bit about how much you think folks are trying to get into the plan, given the uncertainty in Washington about what happens in the future? And what's your sense of, if you're an Obamacare recipient, patient, customer today, what happens in a world where Obamacare is repealed? Can folks feel that they will be grandfathered in, or will they be grandfathered in? How should folks think about what they're signing up for today and what they're getting tomorrow?
With all of the talk about repeal and replace or change or take away, the Affordable Care Act is still the law of the land. And so everything that was in the law and when it was first passed is available to everyone, whether it's the protections or the provisions of the law. And regardless, they have not been able to repeal or replace so far, and I doubt it will ever happen. But when you sign up by the 15th of December, that plan is good for that year. The subsidies are in place, and all of the other provisions, as I said before.
And Donna, why are you certain that it's never going to happen? You said almost certain that you don't think it's ever going to be repealed or replaced.
Well, it hasn't. They have not been able to, and they haven't been able to because people understand the importance of having health care coverage and the fact that it is a right for individuals to have that health care coverage. It was not easy to get the law passed, but it's going to be more difficult to take it away.
Okay. Donna Christensen, physician and former representative for the U.S. Virgin Islands, thanks again for joining us.
Thank you.